A stern new warning tonight about the dangers of the Delta variant. An internal CDC document reveals the variant is as contagious as chickenpox and appears to cause more serious illness than previously thought. It also shows unpublished data revealing that fully vaccinated people might spread the Delta variant at the same rate as the unvaccinated. The CDC says the vaccine does protect against more severe symptoms, though. Paula Tutman reports health experts warn the war has changed in the fight against COVID.
Right now, that Delta variant is the most virulent, but Dr. Ovita Fuller, the University of Michigan virologist who sits on the advisory board for the FDA, says there are 4 variants of concern right now and another 8 that have actually been identified.
We saw Delta was about 3% in May in this country. And now our numbers are telling us that 80% of the cases, the known cases, are Delta.
Dr. Fuller, who sits on the FDA advisory board that approved both the Pfizer and Moderna mRNA vaccines and the Johnson & Johnson 1-dose for emergency use authorization, says it's not too late to stop the highly contagious Delta variant.
We sort of missed our major opportunity to get everybody vaccinated, which would stop replication. So we still now have to deal with this while we're still trying to get the level of vaccination up to protect from these changes.
But she says there is urgency that everyone who can get vaccinated must.
Our opportunity is to stop replication of coronavirus before it changes so well that it overcomes our current immune protection.
Another big concern, children, particularly those under the age of 11 who cannot get vaccinated because the virus, in its replication to survive, will go to the easiest host, and a variant that changes outcomes for children could be next.
It will adjust itself to do that. If that's who is available for it to replicate in, then there will be a variant that will be more transmissible in children that could possibly come up. I'm not saying that will happen, but I'm saying the nature is that could happen.
Dr. Fuller says it's up to every adult possible to protect every child. Again, children under the age of 11 who cannot get vaccinated, thus far, Dr. Fuller says, gives more reason to not only get the vaccination if you are eligible, but continue wearing masks even if you are inoculated.
That's why everyone is now being asked to wear a mask to prevent us putting virus into the atmosphere that can affect somebody else, even though I may not get sick.
Dr. Fuller says the emotion, the politics, the personal opinions have to be taken out of this. Those adults and teenagers eligible for the vaccine must get vaccinated while there's still a window available before something else develops that no vaccine will be able to battle. Paula Tutman, Local 4.